Good day, we are the group 2 and I'm about to discuss the definition of first aid. First aid is an emergency care or treatment given to an ill or injured person. First aid is the first and immediate assistance given to any person suffering from either a minor or serious injury or illness, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. First aid is generally performed by someone. Basic medical training. Mental health first aid is an extension of the concept. First aid to recover mental health. While psychological first aid is used as an early treatment of people who are at risk for developing PTSD.
Danger is defined as the possibility that something harmful or unpleasant will happen or a person or thing that causes harm. When you are alone in a bad neighborhood late at night, this is an example of a time when you are in danger.
R stands for response. Response is not about how people around a victim will respond during a accident. It's about whether the victim is responding or not. Maybe the victim is shaking your hand, or she can respond by speaking or using hand gestures.
Send for help. S stands for send or shout for help. If there are other people present, tell one of them to ring an ambulance. If there isn't anyone to help you, shout for assistance as loud as you can if possible. You can also send someone to get an automated external defibrillator or AED so that you can use it if necessary.
Airway. If the person is responding, they are conscious and their airway is clear. Assess how you can help them with any injury. If the person is not responding and they are unconscious, you need to check their airway by opening their mouth and having a look inside.
Breathing. Check for breathing by looking for chest movements up and down. Listen by putting your ear to their mouth and nose. Feel for breathing by putting your hand on the lower part of their chest. If the person is unconscious but breathing, turn them into their side, carefully ensuring that you keep their head, neck, and spine in alignment. Monitor their breathing until you hand over to the ambulance officers.
Circulation. Perform chest compressions to keep blood circulating as well as rescue breathing. If the person is breathing but unresponsive, check their pulse. If their heart has stopped, provide chest compressions.
If you are with someone having a tonic-clonic seizure, try to stay calm and remain with the person. If they have food or fluid in their mouth, roll them onto their side immediately. Keep them safe and protect them from injury. Place something soft under their head and loosen any tight clothing. Reassure the person until they recover and time the seizure if you can.
Examination. Evaluating the person for sign of injury, bleeding, allergies, or other problems once you know they're breathing and their heart is beating.
Good day everyone, we are from Grade 12 Isaiah. And our today's topic is all about open wound. So what is open wound? An open wound is a type of injury that causes an external or internal break in the body's tissue. It is commonly caused by accidents involving sharp or rough objects that cut through the skin and leave some form of trauma. If left alone, it exposes the body to harmful bacteria, making it at risk of infection.
This is a type of open wound called laceration, and this is how we will treat it. The first step is let's put a clean cloth. This is to stop bleeding or control the bleeding. And then apply some pressure. Okay, then elevate the wounded part. And for the second step, let's clean the wound. Let's remove all the dirt and debris. All the dirt and debris over the area. Then dry using a cotton. If you don't have a cotton, the clean cloth will do. And the third step is let's put antiseptic. Let's put antiseptic. Let's put antiseptic. Or antiseptic is what we call betadine. And then after we will cover it with a clean cloth. Here is the clean cloth. Okay. Let's tie. And that's it.
A puncture wound is a deep wound caused by an object piercing the skin and creating a small hole. Some punctures are surface level, while others can be very deep depending on the source and cause. A puncture wound does not usually result in excessive bleeding. Usually, these wounds close fairly quickly without any intervention, while others can cause excessive blood loss or those that damage the organs can be fatal. Treatment may be necessary to prevent infection in some wounds. A puncture wound from a cause such as stepping on a nail can become infected because the object that caused the wound may carry bacteria or spores that cause tetanus into the skin and tissue. What causes a puncture wound? Almost any sharp object can potentially cause a puncture wound. Common causes of puncture wounds are wood splinters, pins, nails, and glass. Puncture wounds may also be caused by objects such as scissors and knives. When to know if the puncture wound gets infected or is not treated properly. Swelling, pus, or watery discharge, redness, purplish gray or darker than your normal skin are signs of infection. So here are the things that you should do to take care of a puncture wound. Number 1. Wash your hands. Washing your hands can prevent infection. Number 2. Stop the bleeding. Apply gentle pressure with a clean bandage or cloth. Number 3. Clean the wound. Rinse, rinse the wound with clear water for 5 to 10 minutes. If the debris remains in the wound, use a washcloth to gently scrub it off. See a doctor if you can't remove all of the dirt or debris. Number 4. Apply an antibiotic. Apply a thin layer of antibiotic cream or ointment. For the first 2 days, rewash the area and reapply the antibiotic when you change the dressing. Number 5. Cover the wound. Bandages help keep the wound clean. Number 6. Change the dressing. Do this daily or whenever the bandages become wet or dirty. Number 7. Watch for signs of infection. See a doctor if the wound is not healing or you notice any increasing pain, pus, swelling, or fever. When to seek for medical help. If the wound keeps bleeding after a few minutes of direct pressure, if it is result of an animal or human bite, if it is deep and dirty, if it is caused by a metal object.
Directly after receiving a burn, place the affected area under the cool water for about 10 to 15 minutes to stop the burn from spreading the surrounding area. After, remove the items such as ring or light jewelry from the affected area. Deeply a thin layer of aloe vera on the burnt area to help the pain and promote healing. Make sure the affected area is kept clean and dry to prevent infection.
Avulsion. An avulsion is a serious soft tissue injury. It happens when a portion of the skin and sometimes other soft tissue is partially or completely torn away. First aid for avulsion. For small wounds, there is no damage to structures such as nerves, blood vessels, and the like. Wash the wound with water and soap. For the second step, pat it dry with a clean towel. For the last step, apply antibiotic ointment. There is no need to cover the wound. For the large wound with bleeding, control bleeding by applying direct pressure on the wound until bleeding stops. Use a clean dressing or any absorbent cloth. If the cloth is soaked with blood, another absorbent cloth on the top of used cloth. Elevate the injured area.